Quality Improvement Plan. Quality improvement is an approach to measure and improve healthcare services and their processes through systematic and continuous actions. A good quality improvement program can be a balance of quality, efficiency, and profitability within a healthcare organization. It improves the quality of the process outputs by identifying and removing the cause and defects and minimizes variability in an organizational process. Why is there quality improvement programs? Well, there's deficiencies were found in the delivery of healthcare services. Hospitalization, standardizations, medical processes, patient safety and health outcomes, and poor performance. So they did some re-engineering and restructuring of healthcare delivery systems, and strategies and goals were created which improved methods of monitoring and evaluation of performance, and it increased the likelihood of the desired healthcare outcome. Its effectiveness was studied, and this is how quality improvement was implemented. So quality improvement in healthcare, it has 4 key principles, and that's with work as systems and processes. It focuses on patients, it focuses on teamwork, and it focuses on analyzing data. Organizations need to understand key processes for quality improvement, the resources provided along with how they are utilized both affect patient care and achieve the greatest outcome, and they should be addressed simultaneously. Process mapping is a tool used to better understand the process within a healthcare system. It's a visual diagram that gives results based on this sequence of events. So, like I said, you need to have that understand the key processes within the organization. We're using this process mapping as a tool to better understand, and it provides a clinical pathway steps and gains better understanding. So the focus on patients. The organization must understand and meet the needs and the expectations of their patients, patient safety, and coordination of care. So with the coordination of care, it's essential in today's healthcare. Patients are being seen by multiple physicians, and the need to have reliable, secure, and accurate medical records is crucial. And the use of EMR systems is one of the many tools used to allow physicians to communicate with one another and care for patients more efficiently. So the focus on the team. Teams have different knowledge, skills, experience, and perspectives. Solutions need creativity and collaboration. Staff commitment, so you need that buy-in from your staff, and improved efficiency in management and clinical processes. Focus on the use of data. It measures the current process, system, and changes applied. You have to establish that baseline. Allow for monitoring to ensure improvement and comparison of performance, and it reduces placement of ineffective solutions. So the benefits of a quality improvement plan, they yield better patient healthcare outcomes. It reduces healthcare costs. You have high quality care, prevents overuse, underuse, and misuse of services. It provides guidance in identifying what works and what doesn't work. Provider incentive programs or financial rewards based on the pay for performance that Medicare has set up. With the Affordable Care Act, it increases team member efficiency and engagement, and it creates standardizations in policy and procedures. So healthcare must be safe, effective, patient-centered, timely, efficient, and equitable to be successful. Models used for quality improvement. You have care models, which they provide the highest quality disease prevention and management. You have lean models. They maps with patient flow, cost, and effectiveness. You have FADE, which is focus, analyze, develop, and execute. You have Six Sigma, which define, measures, analyze, improve, control. You have the PDCA, which is a scientific method based on like hypothesis, experiment, and evaluation. So it's a 4 steps: the plan, do, check, and act that you see here. You have FMEA, and that is the healthcare failure modes and effective analysis. So it's a measurement used as a multidisciplinary team that evaluates a process to prevent errors. So patient satisfaction. Patient surveys are a great tool to measure and monitor overall healthcare performance from the moment a patient arrives until the time that the patient leaves. This is a good diagnostic tool that can help increase patient safety, decrease liability, and can also serve as a marketing tool. Surveys can be used, and they also help improve healthcare staff morale. Team members work more efficiently and effectively. So just remember, a happy patient is a loyal patient who recommends family and friends, which lead to increased revenue. The patient experience. When a healthcare organization is working on a quality improvement, the importance of the role of the patient experience should be considered top priority. Quality improvement plans, they improve safety and efficiency and are validated by overall patient experience. Patient experience and provider communication, it's linked to overall better healthcare outcomes in both preventative and disease management. And then pay for performance programs, they measure the patient experience with the HCAHPS survey, which reward healthcare providers for quality care. So in today's healthcare, patients, they use online resources to research doctors and hospitals by reviewing patients' experiences. And so physicians understand that the financial benefits of having loyal patients, along with reduced medical malpractice suits, greater employee satisfaction with decreased turnover, and it's more efficient and effective quality of care. I've included here just that we need to make sure that it's patient-centered care, that we're getting good quality. So the importance of survey statistics, data, and quality improvement plans. Surveys are used to help gather information from a targeted group of people, and it's used to conduct research based on data collection. So when conducting a survey, it's important to understand the information that is being obtained. So survey questions need to pertain to the objective at hand. The primary goal to determine the success is by analyzing and evaluating the numbers to determine the information collected. Collection of unbiased information is needed to validate the survey information, and determining the conclusion by identifying the intention of the survey and how does the survey suffice the objective. I've included a survey here. I kind of went in, you stay away from those leading questions, but how does that survey data used in quality improvement? Well, quality improvement plans are used for continuous improvement. So surveys are used to identify a patient's experience of care, measure the patient's satisfaction, and it can be used to determine the organization's specific area or department that needs improvement and what should be focused on. So you can identify the need in the area of that QI plan. By these surveys, you can implement a corrective strategy and demonstrate the wanted outcome. So you want to have valid and reliable survey. So patient survey questionnaires need to adequately and actually measure what's intended for it to be valid. So patient survey questionnaires must be able to be repeated and obtain the similar results. They need to reflect what is really happening. They need to be reliable, so that's how that happens. Organizations need to ask relevant questions. What do they want to know? They use quantitative analysis is an accurate method to measure patient satisfaction surveys. So standardized questions like the CAHPS or the PSQ-18, they're both good to validate and have reliable information. So some data analysis methods are cross-tabulation, trend analysis, max diff analysis, conjoint analysis, CHIRF, GAP, and SWOT, and they'll all help you get that information. So quality improvement committee, they should have a clinical leadership, technical expertise, day-to-day leadership, and project sponsorship. So quality improvement plans should be managed by a committee of diverse individuals who have different roles and perspectives on the patient's care and the process that need to be changed. And you should always have a champion named to ultimately lead that project for you. So I included here some examples of potential members of Quality Improvement Committee, so they can range throughout the hospital. Again, having that diverse group, it just makes for a better outcome. So benchmarking, it's a process that measures performance of an organization's products, services, or processes against another company that is considered the best in class. It can identify areas of improvement. So you want to compare process or services. You want to compare that metrics, identify the gaps, implement change that improve the quality. And so that kind of shows it here. I'll move this just a little bit so you can see it better. So in conclusion, quality improvement plans are used to monitor, measure, analyze, and access organizations' performance and improvement performance for any quality-focused target or action. A diverse quality improvement team, improved communication, innovation, and collaboration in which reflect commitment to promote quality. Quality improvement plans require the organization to continue monitoring to improve goals and meet standards set forth by governing agencies. Establishing a culture around quality in an organization brings about success for all. Thank you very much.